Hello everyone, welcome to this quick video presentation on the unit for strengthening cause of death data. In this video, we will briefly present the unit's background and achievements for this first year. We have two presenters, myself, Dr. Yagnik Waza, and my colleague, Dr. Sharvari Mhapankar, to present on the unit's background and achievements. Let me tell you a little bit about myself. My name is Dr. Yagnik Waza. I am a physiotherapist and working as a country coordinator for the unit for strengthening cause of death data. In this capacity, I support outreach and engagement with stakeholders in India and internationally to advocate for improvements in cause of death quality. I am responsible for coordinating training in medical certification cause of death or MCCD and also serve as MCCD trainer. Let me pass it over to Dr. Mhapankar to introduce herself and the unit.
Hello everyone, my name is Dr. Sharvari Mhapankar. I am a public health medicine professional with a bachelor's degree in dentistry, and I work as the liaison officer for the unit for strengthening cause of death data. I am responsible for liaising between various stakeholders nationally and internationally. I advocate for best practice in MCCD, CRVS, and the unit's resources to government and non-government agencies throughout India. I am also a trainer within the unit for medical certification of cause of death. In this brief video, I will present on the unit's background before passing it back to Dr. Waza to present on the unit's accomplishments in its first year. The vision of the unit is to support, promote, and advocate for best practices in improving quality of cause of death data. To achieve this vision, the unit has established the following goals: to develop resources on cause of death improvement activities that can be used to guide engagement with government and non-governmental agencies, or can be used independently by agencies to support their efforts. To build capacity to improve cause of death activities in Indian and Asia-Pacific region. The activities include training in correct medical certification of cause of death, mortality coding, ICD-10 and ICD-11, and the production of vital statistics reports, etc., and support in the implementation of IRIS and automated software in coding. The final goal is to catalyze improvement in cause of death quality standards through advocacy efforts. The aim is for the unit to be a reliable and excellent resource for cause of death activities, including capacity building in mortality coding, ICD-10 and ICD-11, providing support for coding systems establishment, training of doctors in medical certification of cause of death, what we will abbreviate in this presentation as MCCD, training of analysts and program managers in vital statistics, and production of analytical reports. The unit advocates for improving standards and efforts in India for high quality cause of death data. The unit is guided by the leadership of Dr. RAJESH DIKSHIT and Dr. Pankaj Chaturvedi. Dr. DIKSHIT serves as the director of the unit. He is an epidemiologist working in the area of cancer for over 3 decades and is also the director for the Center for Cancer Epidemiology at the Tata Memorial Center, Mumbai, where he leads multidisciplinary research programs. Dr. Chaturvedi serves as the deputy director for the unit. He is a head and neck cancer surgeon and the deputy director, Center for Cancer Epidemiology at Tata Memorial Center, Mumbai. The unit is supported by a team that includes the staff listed on the left. Additionally, the team is supported by technical experts who serve in the capacity of technical advisors or members of a national or international advisory committee. Let me now pass the floor to my colleague, Dr. Waza, to speak on the unit's achievements in the past year.
Thank you. The unit was launched in August 2021 along with the MCCD e-learning course developed by the unit's team. This MCCD e-learning course is free of charge and is accessible for completion by all on the Omnicourse platform. MBBS doctors who complete the e-learning course can receive 1 CME point through their state medical council. Ayush doctors, doctors in other countries, public health experts, anyone can receive a certificate of completion upon completion of the course. We have made this training accessible to all given the importance of good quality MCCD for policy making and program planning. So far, 9,500 doctors have enrolled in the e-learning course on Omnicurus. The unit has trained a cohort of MCCD trainers to conduct in-person and virtual training across India, through which we have trained an estimated 1,000 doctors. You will hear about this as I review the unit's engagement across India. In Maharashtra, the unit has supported MCCD training in various hospitals and has successfully advocated for Hinduja Hospital and MCGM to integrate the MCCD e-learning course into their training requirements. In Andhra Pradesh, the unit collaborated with Andhra Pradesh Vidya Vidhana Parishad, Government of Andhra Pradesh, to train 300 state government medical doctors on MCCD best practices. In Nagaland, the unit has actively engaged with the Department of Health and Department of Statistics and Economics, Government of Nagaland, to implement a district-wise training of trainers in MCCD and institutionalize the training of doctors in MCCD and ICD coding. In the Uttar Pradesh unit has supported MCCD training in various hospitals and presented on the importance of MCCD at state level seminars on birth and death registration. In addition to this in-person and online training, the unit has also started developing a library of short information videos on various causes of death topics, MCCD, coding, and Irish, and automated coding system. The unit had posted these informational videos on its YouTube channel to allow for easy access to information on these core cause of death topics. You can see a selection of YouTube channel topics on the screen. Let me pass it back to Dr. Mhapankar to speak on the unit's upcoming events and conclude this presentation.
The unit continues to plan in-person and virtual trainings on MCCD and the use of the MCCD assessment tool, which can be used to assess the quality of reporting on MCCD forms. If you are interested in coordinating a training, please contact the unit. The unit will continue creating and posting informational videos on its YouTube channel. These videos are not intended to replace any trainings, but serve to provide basic understanding on a specific topic. The MCCD videos can easily be shared among doctors' groups for a quick reminder on good quality medical certification. Please consider sharing these videos to help you in your efforts to communicate on the importance of good quality cause of death data. Thank you for listening to our brief presentation on the unit for strengthening cause of death data based at the Tata Memorial Center, Mumbai. We hope you enjoyed learning about the unit's vision, aims, and accomplishments in its first year. Thank you.